Monticello is nestled between Lake Schaefer and Lake Freeman, and Monticello has a population of around 5,500 year-round.
Mayor Gross came to us and said, I have this idea that I saw working in a community like ours. It's called community paramedicine, mobile integrated health. I want you to figure out what it is, and I want you to get it in our city. And I said, yes, ma'am.
Kind of gave him a challenge. See what you can do. Learn about community paramedicine and mobile integrated health. And by the way, there's not going to be overtime. You're not going to get anything, and you better make it work.
Mobile integrated health is important for rural small-town communities because it really lets public safety take a step into people's lives and be more proactive. So often we're reactive. You call 911, we respond, and we help with whatever problem they're having. Mobile integrated health can step in and be that proactive person to help them through that issue. Whether how big or how small they are, we can help. We did a pilot program through IU White Memorial's hospital where we took 50 patients discharged from the hospital after their stay, saw them for a minimum of 30 days, and at the end of that 6-month pilot program, we were able to show them a 0% readmission rate, meaning none of those patients readmitted within the first 30 days out of the hospital. Later that year of 2021, they donated $100,000 to be able to start our program. Mobile integrated health has been able to develop and grow organically over the last couple years of us doing this. We've added a maternal and infant health specialist.
What we know is the state of Indiana is currently 3rd in the nation for infant mortality. That is unacceptable.
The program is designed to work with mothers from the time of referral through 4 months postpartum. Mobile integrated health fills the gaps in the challenges of healthcare access in a beautiful way because we are accessible. We grew up in this community, we know this community, and we're able to just be an advocate for these patients and help them to understand what's an emergency and what's not.
It is truly a way that cities and towns, as they're stripped away from resources from big, communities that we don't have, it's a way for us in public safety to step out and say, I know there might not be everything in the world here, but we're here and we can be that bridge and connection to be able to help you as you age in place.
Come in.
Hello, how are you?
Oh, good to see you.
Good to see
Thanks
you guys
for
too.
coming.
Hi, Nick. Hi, Skip. How are you today?
Meeting Nick was a real joy because it was like family, On the Sunday morning, and I had gone to church, he was going to join me. He got the truck out, came into the garage, put the cane in a little damp spot on the floor, and took a fall.
Well, hey, let's check your blood pressure real quick while I'm here. I think one of the most important things about mobile integrated health is being able to slow down time a little bit and show these people how important it is and their healthcare journey to stay at home. Whether it's simple medication reconciliation or blood pressure checks that makes that person feel comfortable, it ultimately lowers their stress. Staying out of the hospital, unwanted medical bills, transportation, all the things that we have in our healthcare journey, what it helps them do is just alleviate all that. And sometimes just a simple phone call or a quick 1-hour checkup with somebody can alleviate all those down the hill problems that we might have in healthcare.
I was kind of bad shape many times, and half hour with Nick, it was gone. It's a personal thing along with a medical thing.
Yeah.
To have somebody that you can call and trust what he's going to tell you.
Rita is a great example of what happens when your loved one is no longer able to progress in their healthcare journey and how we can help that transition into palliative care. So Rita came to us and our program with an aging husband and didn't know what to do next. Nobody out there could help her with what steps were to do. So we helped in that palliative setting, and ultimately through the passing of her husband, we were able to help her from when she no longer needed mobile integrated health. And that is a huge blessing to us through public safety.
You just have to have some help. That's it. There's no way. And I did everything I could to keep Rex at home and not to go into a nursing home. I did everything I could, and they helped me keep him at home. And that's what he wanted to do. When Rex's funeral, they were pallbearers because my husband was very much into that uniform. So I don't think you could ask for anything better than that.
Nick and I in our programs together are able to work toward educating our neighbors in a way that allows them to make healthier choices and therefore be healthier individuals. And healthier mamas, healthier babies creates a generation of healthier adults. And with Nick and his education and support in the population that we're hoping to keep aging in place, it allows them then to be healthier also, because a lot of times the mothers are not only caring for their infants, they're also caring for aging parents. So educating the mother on proper nutrition and what that would look like then has a domino effect both ways, down a generation and then up a generation if necessary.
You know, you hear the term all the time, win-win, but this truly is one of those win-win. None of it can happen alone. We all have to work cooperatively, and now we're looking at opportunities with other community partners, donors, and most especially to try and find a mechanism for sustainability. Let's do that. Let's create a better culture for all kinds of health, from maternal health to aging in place. We will make a difference and improve the quality of life.